Meningitis Vaccines by Lisa Brewer and Chrissy Moyer. Meningitis is an infection that causes inflammation of the membranes covering the brain and spinal cord. There is a bacterial and non-bacterial meningitis. The common causes are viral and bacterial infections, fungi, chemical irritation, drug allergies, and tumors. Bacterial infections of the meninges are extremely serious and can result in death or brain damage even if treated. These vaccines help prevent certain types of meningitis from developing. Two common vaccines are Haemophilus vaccine, also known as HIB, and pneumococcal conjugate vaccine. Haemophilus influenza type B disease is a serious disease caused by bacteria, and it usually affects children under the age of 5. Before the vaccine was invented, HIB was the leading cause of bacterial meningitis in children. The HIB vaccine prevents children from getting HIB disease. The vaccine is a conjugate vaccine. It joins sugars from the HIB bacteria with a protein from another bacteria. The protein stimulates the baby's immature immune cells so they produce antibodies to the HIB sugars, protecting the child from HIB infection. Children should get the vaccine when they are 2 months, 4 months, 6 months, and between 12 to 15 months of age. Depending on what brand of HIB vaccine is used, the child might not need the vaccine when they are 6 months of age. Older children and adults do not need this vaccine, but children or adults with special health conditions should get it. The special health conditions include sickle cell disease, HIV or AIDS, removal of the spleen, bone marrow transplant, and cancer treatment with drugs. The HIV vaccine should not be administered if the child is less than 6 weeks of age, a severe allergic reaction resulted from the first dose of the vaccine, or the patient is ill at the time the shot is given, so they should wait until they are healthy again for it to be given. Side effects include mild and severe side effects. The mild side effects are redness, warmth or swelling where the shot was given, fever over 101 degrees Fahrenheit, and allergic reactions. The severe side effects include serious allergic reactions, where the symptoms include difficulty breathing, wheezing, hives, paleness, fast heart rate, and dizziness. You also could have high fever or a change in behavior. If any of the severe side effects appear, the doctor should be informed immediately. Infections with streptococcal pneumonia bacteria can cause serious illnesses and even death. It is a leading cause of bacterial meningitis in the United States. These infections can be very hard to treat, but the pneumococcal vaccine helps prevent these infections. The vaccine helps prevent pneumococcal diseases such as meningitis and blood infections. This vaccine is approved for infants and toddlers. The vaccine stimulates a person's immune system, so that the immune system cells develop a memory for the 7 pneumococcal types. When the body is exposed to one of these types in the future, antibodies are made in large quantities, which either prevent the infection or lessens the severity. Children under 2 years of age should receive this vaccine. There are 4 doses for the vaccine, and the doses should be given at 2 months of age, 4 months of age, 6 months of age, and when a child is between 12 to 15 months of age. Children between 2 and 5 years of age that have sickle cell disease, a damaged spleen or have no spleen, have HIV or AIDS, have other diseases that affect the immune system, such as diabetes, liver disease, or cancer, or have chronic heart disease, should also receive this vaccine. People who should not get this vaccine are children who have had a severe allergic reaction to the first dose of the vaccine, so they should not get the second shot. Also, children who are moderately or severely ill should not get the vaccine until they are healthy again. The side effects of this include redness, swelling, tenderness where the shot was given, fever of over 100 degrees, and drowsiness. The risk of this vaccine causing serious side effects or death are extremely small. Meningitis vaccines are very helpful in preventing certain types of meningitis. They do have side effects and only certain people should receive them. Since the meningitis vaccines have been used, the occurrence of meningitis has declined, especially in infants and children. Thank you very much for your attention.